So we are talking about substance misuse over here. Substance misuse can be regarded as when a person basically starts taking a psychoactive drug in amounts that are not very much correct physiologically, and the person also develops dependency towards that drug. Now, this dependency, whenever we talk about it, it can be a physical kind of a dependency as well as the psychological dependency as well. So over here in this section, we'll be discussing the wide range of the illicit drugs that are available in the market. And obviously, these drugs are easily available in the market. Now, the age group that is particularly subjected to this kind of an illicit use of the drugs is basically regarded as the youth or the adolescent age group. So this is the age group that is usually targeted towards it. And what are the risk factors for developing this kind of an addiction? Obviously, these risk factors come from the personal instincts as well. From within that person, how is the psychological state of that person? That is going to be assessed by the psychiatrist. And then there are a lot of environmental factors that can play a very pivotal role in the development of these kind of addictions. So we'll be discussing all of this over here in this section. We'll be discussing the definition of substance misuse over here particularly. When do we call it? It's basically the misuse of a particular drug. Obviously, there are a lot of drugs that are used and the pharmacotherapies as well, but still there are but these drugs have their addictions as well. So we'll be discussing as well, when do we regard it as a misuse of that particular drug? There is a narrow borderline between the pharmacotherapy of a drug and the misuse of that particular drug as well. And then we'll talk about the range of the illicit drugs that are available in the market, and what drugs can be used for these drugs of addictions or these misuse of the drugs. We'll be discussing smoking, which is socially acceptable in our society, in different societies as well, but still it has its hazardous effects, and it basically affects the quality of life of that person as well. And as well as we can also discuss it in the psychological or it has its physical dependence as well. So we'll be discussing all of this over here in this section. Now, when we regard the significance of the misuse of the drugs, there are no major specialities or subspecialties to it. You can avoid the substance misusers as well, and then there is the substance problems as well. May not be his or her major problem, but still, if a person gets addicted to a particular kind of a drug, the people who are surrounding him, his family, his friends, all his colleagues are going to be affected due to that drug addiction or due to that misuse of drugs as well. So there are various departments that we'll be discussing to generate the share of the patients. And then the presentations. How will the patient walk into your clinics, and how are you going to diagnose that he's basically suffering from a particular kind of a drug addiction cases? So there are a lot of symptoms that you have to look for. There are these acute symptoms as well as the effects of intoxication. So it can be a chronic case as well as it can be an acute case. There are a lot of symptoms to that. And then the withdrawal syndrome. So when you withdraw that drug, you look for those withdrawal symptoms in that particular case. Now, it depends upon the drug of addiction that the person is taking. It can be the alcohol, it can be the opium use, or it can be the cannabis. So all of these have different withdrawal symptoms, and we'll be looking at those symptoms, and we'll be looking at those signs and symptoms. And those syndromes have to be kept in mind when we are looking at a patient of that particular kind of a substance misuse. Then the chronic use of substances. So we have to keep in our mind that the person basically develops tolerance to that particular kind of drug. So when he develops tolerance to that, he'll basically automatically increase the dose of that drug to get those particular symptoms of elation that he usually experiences after taking that drug. So this can be kept in mind as well. Then the convulsions, the person can come up to you in a state of an epileptic convulsions. Now, acute disturbances, psychosis, panics, or confusions. So, all of these is basically going to indicate that the person is on a particular kind of an addictive phenomena. The cancer or cardiovascular conditions have to be looked for as well. So, all the symptoms, all the systems have to be looked for the signs and symptoms. For example, the cardiovascular system, the CNS, as well as the respiratory system. So, all of these symptoms collectively will give you an idea for the addiction phase. The alcohol problems are basically 4% of the global disease burden, and the alcohol misuse is the commonest misuse that we come across. The mortality is associated with drugs and alcohol 16 times. It's basically higher than the rest of the drugs of abuse, and there's a high risk of the drinking behaviors as well. Because again, this phenomena is quite common because of the social acceptability of it in the particularly developed countries. So the advice about alcohol consumption by the Department of the Health should be the men shouldn't drink more than 3 to 4 units a day regularly. The women should not drink more than 2 to 3 units per day regularly. And the regularly means most days of the week. If episodes of heavier drinking occur, people should have 48 hours alcohol-free periods. So these are the precautions that can be taken by that particular person. Then the Royal College of Physicians basically give an advice. Men shouldn't drink more than 21 units. Women 14 units a week, provided the total amount is not drunk in 1 or 2 bouts. And then there are 2 to 3 free alcohol days for a week, regardless of the gender that we're talking about over here. So the illicit drugs, the proportions by age that are reported is usually 16 to 39 years is 13%, and 40 to 59 years is 3 to 6%. And then the age group between 16 to 59 years is 8.6%. So the proportions reporting misuse of prescriptive drugs that usually give as pharmacotherapies, the men in the age group 16 to 24 is 8.8%. The women 16 to 24 is 5 to 6%, and the men between 25 to 59 years is 5.8%, and the women between the age group 25 to 59 is 4.1%. The classes of the illicit drugs, they can be categorized into the 3 major classes, class A, B, and C. The class A are usually the ecstasy, LSD, that is basically the lysergic acid, diethylamide, heroin, cocaine, crack, magic mushrooms, and amphetamines. So these are the group of drugs over here. In the class B, we have amphetamines. Along with it, we have cannabis and methylphenidate and folcodine, etc. So even folcodine is basically kind of a pharmacotherapy that is usually a prescriptive drug. So in the class C, we have all the benzodiazepines that are usually the prescriptive drugs by the psychiatrist, and the hypnotics and some painkillers, gamma hydroxybutyrate and ketamine. So these are the kind of drugs that are quite in the prescriptive form. We usually give them, or we usually prescribe them, and the person can develop addiction to these drugs as well. Smoking causes more preventable deaths, and 2/3 of the smokers start before the age of 18. The higher rates in the economically deprived groups, the impacts on the smoker families are quite evident, and the illnesses are due to the secondhand smoking. So in this section, basically, we defined the wide range of drugs that are available for the substance misuse or for the drug addiction. So that is the end of this section. Thank you for watching sqadia.com.